Hey, Dr. Timothy Harcourt here, third generation chiropractic physician. We're going to go over the Graston technique today. So we're back with you talking about the Graston technique, and we're looking at the front of the shoulder here. You know, there's tendons that many times are affected in the shoulder that cause shoulder pain. And one of the major tendons that gets irritated is the long head of the biceps, which you see right here. And the other ones are the teres major tendon and the subscapularis. These are internal rotators on the shoulder. In other words, they turn your shoulder inwards. Now we're moving to the back part of the shoulder back here. Those are external rotators. And which ones get irritated there? Well, the most common one that we're looking at here is the infraspinatus tendon gets irritated quite easily. And then we have the teres minor tendon also gets irritated. And then the one that lifts the shoulder straight out is supraspinatus. It's the most common tendon to get irritated as a rotator cuff tendon. Next, we're going to talk about how Graston technique can help you get over your shoulder pain. So maybe you've had an MRI, it shows that you have a partial tear in your shoulder. Hey, if you have a complete tear, grade 3 tear, that requires surgery, but fortunately 98% of the shoulder tears are not complete. So that means that they probably will respond well to Graston technique. Now with Graston technique, we're not cutting, injecting, or drugging. So one of the benefits of that would be that you don't stand the risk of a rejection of a medication that would be injected in. You're not standing the risk of weakened tissue from a steroid. You're not standing the risk of a MRSA infection from introducing invasive procedures to your shoulder. This is non-invasive. It comes from the outside, and we use tools to do that. In just a minute, we'll show you how we do that, but how does it actually work when we do it? When we stimulate the tendon with the tool, it stimulates the body to heal that tendon by ridding the acids off of the tendon. There is actually a glue that sets up inside the tendon, either the supraspinatus, infraspinatus, or the other tendons we mentioned, and that just acts as an irritant. And unless we scrape that off and allow the body to heal, you can take all the anti-inflammatories you want and it won't get rid of the problem generally. So Graston is by its very nature specific to where the problem is. Yes, you will feel it when we do it, but it helps your healing as soon as we apply it. Now, when we do the Graston technique, we are using the official Graston tools. And each tool is made for a different body part. There's several tools that we use. In the shoulder, a lot of times we'll use the GT4, and what we will do actually is we will stimulate the tissue by coming through the skin, and we will sometimes do cross friction type of approach, and then other times we'll go along the length of the tendon. Now, when we do that, regardless of where it is, if you actually have a problem there, you're going to definitely feel it. One of the benefits of that is that you know we're hitting the spot. I like to say that if I'm a half a mile away from where the problem is, it's actually not going to help you. Same thing with the surgeon. If he cuts the wrong body part out, it probably isn't going to help you much. As I mentioned, there's different tools for different body parts. You'll see the contoured tool here with the Graston technique tool for the fingers, the wrist, and curved body parts. So you can tell that this isn't symmetrical, and what we do is if it's a finger, say like somebody has tendinopathy of their finger, trigger finger, that type of thing, we will use a lotion and we will stimulate the tendon in this fashion. And then of course we have different sizes depending on it. You know, everybody's a different shape. We use the large one for the back, so you can see how that's contoured, so that if we come across somebody's back, that's contoured nicely for their particular body part. If we were to show a lower back, you could see that if we stimulated the muscles of the back in this respect, how that would be very comfortable for the patient. And then other tools are used in a general sense. This is an overall around tool that we can use practically anywhere in the body. Somebody with a carpal tunnel syndrome will come in on the transverse carpal ligament and will actually stimulate that ligament and give more room for the median nerve, which typically innervates this finger, and this area here. So this tool is a great tool for overall areas in the body. And then lastly, we have another tool that we can use for some of the larger muscles in the body, a biceps, a triceps. We can do the wrist extensors. If somebody has tennis elbow, we can get in on this area real nicely with this one. And then we might come in with the general tool and get right in on that insertion into the radial head. So the tools have different applications for different body parts to help you get over your problem in a natural, non-invasive way. The main takeaway about Graston technique is that, first of all, it's non-invasive, it's non-surgical, it's non-addictive, and it's also directly to the body part that needs attention. The next thing about Graston is you will feel a difference right away. It's a beautiful thing. So as soon as we do the Graston technique, before you leave the office, you are going to see a difference. The next thing about Graston is we're doing it in a natural way. We're doing it naturally. So we call that natural pain management. And the Graston technique also is a technique that's been around for approximately 20 years, and I've been doing it for almost 20 years. It was developed at Ball State University in Muncie, Indiana. Thank you so much for watching the video. Know you need to go in a different direction? Call and we'll have a sit-down, no-charge consultation.